Cardiac rehabilitation is a proven method which actually helps somebody deal with a heart-related event, optimize outcomes, and reduce the risk of this happening again after they come out of hospital. It's a program which involves some education, understanding of the condition, understanding of the treatment and the medicine thereon, some lifestyle and risk factor modification, dealing with stress and reducing stress, psychological health, things like smoking cessation, and learning about the right kind of exercise. It usually takes place after somebody has had either a heart attack or some kind of an operation in hospital, for example, a stent to the heart, or open heart surgery, or heart valve problems, or heart failure, or they've had a heart transplant. These are the common reasons why people undergo cardiac rehabilitation. Phase number one, the patient is contacted by the cardiac rehabilitation team once they're in hospital, and they are given a bit of information and a contact telephone number. Phase number two is after the patient goes home, but not long after discharge from hospital, a few weeks, where the patient has a chance to go through the information whilst they're recovering, and they also have a contact number just in case they need more information. Phase three starts usually 4 to 6 weeks after discharge from hospital. And this starts usually by an individualized interview where things are assessed. A lot of time is given to the patient to ask questions, and then they get offered a place in the cardiac rehabilitation program. And this program takes place traditionally over about 12 weeks. Although, of course, in the pandemic, we've managed to shorten this program to about 6 weeks by using virtual means. But traditionally, it takes about 12 sessions where these lectures and interactions are delivered along with exercise programs. There are many different kinds of exercises which are part of cardiac rehabilitation. The most common one is the shuttle walk, where people are timed walking from one place to another, and then the results from when they started the course and to when they ended the course are compared. But of course, some people can't do that. Okay, some people find it much more difficult to walk, and they have to have balance exercises. Some people prefer strength training, light resistance. Some people will go on the bicycle. Whatever it is, there are no right or wrong exercises for people. They are just individualized and tailored to people's needs. Some people, for example, can't do any of these things which I talked about, and they have to undergo a hydrotherapy program. Sometimes an exercise program is not possible. Are there any disadvantages of cardiac rehabilitation? Essentially, there aren't. However, some people just can't do the cardiac rehabilitation program. That's because they have something else going on which prevents them from doing so. Decompensated heart failure, very bad lungs, perhaps severe mobility issues. These are the people, of course, who this program doesn't suit very well. Sometimes, although we do try to work around it. Sometimes people drop out very early, sometimes people are too busy to attend, but there are as such no disadvantages to the program. Well, they're both very similar programs, but pulmonary rehabilitation focuses mainly on lung disease, exercise training, and breathing exercises, although there are quite a lot of similarities. It measures the oxygen demand of the body. It's got a different educational content, although some content is similar, because people who have chronic lung disease often tend to have chronic heart disease as well.